Need to get some TV lights right there. Just down up there.
Well, you reach a certain time in life when your eyes don't work like they used to. All right. So we have staff on the phone. Oh, but we can't hear from them, though, can we? Okay. All right.
You don't need to unmute that.
Yeah. Okay. Thank you. Hey, good morning, everybody. Thank you for joining us. As I understand, we have people calling in on the phone, and there seem to be some issues with communicating. I apologize for that. It's just it's a Friday thing, I guess. Normally, we would ask you to hit *6 to unmute and then *6 to mute. You may have tried that, and that may not have worked for you. But as Ryan said a few minutes ago, please email Ryan your questions if you can. We're working on trying to get this fixed so that we can talk to you live. But if you don't know, it's ryan.easterling@adph.state.al.us, and he's going to be feeding me those emails in real time here, so we'll do our best to get to everybody's questions. Thank you again for joining us. We really are trying to do this for you all in the press, just to answer questions, and this is really your time, and so we're happy to continue doing these briefings every week as long as they're helpful to you all. Let me just cover a few items. I have a few notes, and then give you some numbers, and then we'll be glad to answer questions. Remember, as of last Monday a week ago, we have expanded eligibility in Alabama to include not just the 1A group, but also the full 1B, Phase 1B group, as well as people age 65 and older, and that's the eligible population in Alabama. That number totals somewhere more than 1.5 million people. There's certainly very large numbers of Alabamians in that group. We're a state less than 5 million people, so at least 1.5 million or more are currently eligible. We still have a very limited supply of vaccine overall. That number is increasing somewhat. I'll give you some numbers in a minute on what we're receiving, but still relative to our population, we have a shortage of vaccine, just like every other state in the country. We had a lot of inclement weather this week. As you know, with snow and ice that closed many of our clinics that were scheduled. We are working very hard to get everyone rescheduled. We initially just issued a blanket statement on Monday that all Monday appointments were going to be moved to Saturday, and that still is the case unless people have been contacted and specifically told otherwise. In terms of those people who were scheduled for other days, we're reaching out to them individually to try to find times to reschedule them. Some of our health departments that have reopened have been having longer hours. They'll also be trying to add people from some of these other days to Saturday as well. So we'll get those people as quickly as we possibly can. But by and large, most of the shots we're giving in the county health departments this month are second doses. That's not all true, but most of them are. And so we want to remind people that the guidance we have on second doses is that even though we try to give a second dose about 4 weeks after the first with the Moderna vaccine, which is what our county health departments have, CDC has said that that second dose can be administered up to 42 days later, up to 6 weeks later. And so we certainly don't want to take that long. We believe we can get most people in the next several days, but we hope people can take some comfort from the fact that they can still get fully vaccinated and have the immune response we want them to have, even up to 42 days between doses. During last week, February 8th through 12th, were our clinics. Actually, I think one of the clinics extended on to Saturday the 13th. We gave more than 150,000 doses total. That included the 8 large sites around the state, as well as all the other providers who were given vaccines. We had some issues that we talked about last week with data input, and we're still working on that to some degree. Even though we've now reported more than 150,000 doses given last week, that number may actually go up just a little bit more as we continue to put in information from those large sites last week. We got some information about what we expect next week. We expect more than 90,000 doses next week. Our first doses of Moderna next week are up about 5%. We are expecting 44,100 doses next week of Moderna first doses. and then the same Pfizer allotment, which is about 30,225. We also will get second doses of each one of those products as well. So in total about 70, anyway, somewhere around 80 to 90,000 total doses there. Let's see. I was asked to mention a couple of specific things. There was a Saturday mass clinic here at the Montgomery Mall on the 30th that the health department ran. It was that single day, not the big clinic last week. But we just wanted to remind people that they need to come back to that same location on February 27th, and that's when they'll receive their second dose then. That was a Moderna clinic, so that'll be 4 weeks after the initial shot was given. Also, for those who got their first dose during the mass vaccination clinics last week, we will have vaccine to supply those second doses, and they're going to be given in March. That'll be probably 3 weeks for the Pfizer sites and 4 weeks later for the Moderna sites, but we'll give you more information on that very soon so that people know exactly when to come back and where. We have not heard a lot more about the Johnson & Johnson vaccine probably than you have. We know that yesterday was 2 weeks since that emergency use authorization application was submitted to FDA. The previous two products, took about 2 weeks to get approved. So the clock's ticking on that. It's been about 2 weeks now since they submitted that. We know that the VRBPAC, which is the portion of the Advisory Committee on Immunization Practices, is supposed to meet a week from today, and so presumably we're going to hear something between now and then. Assuming that that's authorized, then they'll make their recommendations to CDC, and then we may maybe have some vaccine shipping in the first part of March. We don't know how much we're going to get. Johnson & Johnson, as you know, did not scale up and make tens of millions of doses ahead of time like Moderna and Pfizer did. There was a statement in the national press yesterday from the White House that said J&J has already made a few million doses, quote unquote, a few million. So I don't know what that means exactly. Typically, based on Alabama's population, for every million doses of vaccine that go into the pool for states, we get about 15,000 of those. That would be sort of Alabama's share of a million doses. So if there's a few million doses being added, then that is just a calculation we're doing here informally, but we've not heard any specifics on that. J&J has said that their plan is to produce 100 million doses by June, assuming that everything goes as expected. We have identified, as you know, the UK variant. We've talked about that here for a couple of weeks. It is circulating in Alabama. We found it in about 5 different counties so far, a total of 8 different cases. It's undoubtedly much more prevalent than that. We're not doing a tremendous amount of testing for that, although we are submitting samples weekly to CDC for them to just randomly look for variants. We also have some folks here in the state, some academic centers and then some private and commercial laboratories that can do that testing for us when a clinician feels like it's indicated to do that. So we really have found these variants in the areas where we have submitted samples for testing. It's shown up in our 4 largest metro areas in the state, and so undoubtedly it's probably circulating much more than we know about. At this point, we don't know that it is a worse virus in terms of morbidity and mortality. There's been one study released this week that suggested that maybe it was. That was actually done in the UK. Most folks have not agreed that that's the case yet, but it certainly is easier to transmit. To the best of our knowledge, the current vaccine products work fine for the UK variant. There's no need to do anything different. That's not necessarily known to be true for the South African variant and the Brazilian variant, which, as far as we know, we don't have in Alabama at this point. I will tell you that of the 8 variant strain cases we picked up, there were a couple that had traveled out of state, but I think 6 of the 8 had not traveled out of state, indicating that they got infected here with it. The federal retail pharmacy program continues to continues on. As you know, Walmart initially put about 200 doses of Moderna vaccine in 74 of its stores around the state. In a call we had with them earlier this week, we learned that they're probably going to add about 17 more sites. I don't know exactly yet where those are going to be. We talked to them about our thoughts about where we would like vaccine to go, but ultimately that's a decision that they make in conjunction with the federal government. So we will give you more information on that as soon as we know. At the national level, the Federal Retail Pharmacy Program folks have said they're also looking at trying to add additional partners in each state, so not just more stores for the original partner, but also additional partners. But we don't have more information on that yet, but hope to know that soon. Just as a reminder, that vaccine does not come out of Alabama state allocation. That's a separate pile of federal vaccine that doesn't subtract from the amount that we have here in the state. As I mentioned to you last week, there has been new CDC guidance that Alabama now has formally adopted related to quarantine rules for vaccinated persons. The guidance states that if someone is fully vaccinated, then they don't necessarily need to quarantine after being exposed to a case of COVID-19. There are some specific criteria there. It's someone that is fully vaccinated, that is, they received, in the case of Moderna and Pfizer, 2 shots, and they are at least 2 weeks past their second shot, which gives them time to develop full immunity. Also, of course, they have to be free of symptoms. They're not someone who actually seems to be sick or seems to actually have active infection. And the other bit of guidance there is that this only applies to people who have completed their vaccination within the last 3 months. And the reason for that is simply the vaccines just haven't been around long enough for us to know what the duration of immunity is. Probably it'll be a lot longer than that. But at this point, you need to be fully vaccinated at least 2 weeks ago, but not more than 3 months ago. And if that's the case, then you do not need to quarantine if you're exposed to a case of COVID, as long as you're not symptomatic. Finally, we mentioned to you last week, we've started reporting race and ethnicity data, as well as age data and other types of demographics on our website. We'd encourage you to please take a look at that. We care very much about the equity of this vaccine rollout. We want to make sure that we're reaching all communities. We know that African Americans in Alabama have disproportionately borne the burden of this disease, particularly death, and we want to make sure that we're fairly reaching them with the vaccine program. At this point, as of today, it's about 54% of vaccine went to white Alabamians, 11.7% to African Americans, but then a full third are just not known yet, that haven't been reported. So we don't have complete data on that. We don't think that's good enough in terms of our outreach to African Americans, so we continue to work on ways to do that. It's certainly better than the national average, but given that Alabama is about a quarter African American, we certainly want to improve that number. So we do want to encourage our providers to remember to please collect this information. States traditionally, including Alabama, have just not collected racial data on things like vaccination. So it's a new step for people. We have to remind them to do that. In the way that they report it now, they are required to do that, but it still sometimes can be challenging to collect all that information in a timely way. So we want to remind providers to continue doing that. I'll say just one final thing about our case numbers. Our case numbers, as you know, have improved, just like they have nationally. We set a record for deaths in January. More than half of all of Alabama's deaths have occurred since Thanksgiving. Somewhere around 60%, I think, have occurred since Thanksgiving. And yet, the last couple of weeks have actually looked very good. We're still not quite down to the numbers we were back in the early part of the summer, but the trajectory looks very good. There's a lot of debate and speculation on why that's happening. I think certainly the fact that this country has vaccinated millions of people probably has some role to play in that. Probably there is also a modest amount or a moderate amount of actual natural immunity, because just so many people have been infected at this point. at least some of them probably continue to have some type of natural immunity. And now that we're through the holiday season, perhaps there aren't as many people having the type of gatherings that we see in November and December. All those are certainly possible reasons. We hope that the trajectory continues down. We'd love for this disease just to go away on its own, but we just don't know for sure at this point. The final set of numbers I wanted to give you was just from the vaccine program itself. Alabama's given a total number of vaccine doses so far of 717,477. So that's 717,477. That's the total number of doses that we've given. We've had about 530,000 people that have received one or more doses, and then 186,578 who've completed their vaccine series. 186,578 is the number of Alabamians that have actually completed their vaccine series so far. So with that, I'm going to pause right there. I'll be glad to take questions. We'll start here in the room, and I know Ryan's got some questions he wants to ask as well. So, okay. Yeah, Kim.
I know many states, and I apologize, you touched on this a little bit, many states are saying they're experiencing shipment delays because of the weather and other reasons. What is Alabama being told? Are we experiencing delays, being told we might?
Yeah, we certainly have had some. The questions about shipping delays because of the weather, we certainly did have shipping delays in several counties. We had some counties that received vaccine but just had clinics that were canceled. But we had some clinics that just simply weren't able to be open for anything to be delivered. And of course, there were a lot of our deliveries come from the Memphis area into Alabama, and of course, Memphis has it worse than we do right now. So. We have been talking to McKesson as well as to Pfizer directly about their shipments every day, every hour almost, and trying to make sure that we get all those things put back on schedule. It certainly has delayed some clinics for people. We've had a number of calls from providers around the state who were anticipating second doses coming in, and those are just going to be delayed for a few days. But they will all arrive eventually. So.
Are we receiving assurances that those shipments won't be spoiled?
Well, yes. I mean, they're monitored in transit, as you know, electronically for the environmental conditions that they are in, and so if there are any problems with that, we certainly would know that. So, don't think they're going to thaw out at least. So, yeah. Next, yeah.
Dr. Harris, what can you tell us about how is the state ensuring that people from out of state, say those people that are on that Georgia line, are not coming in and getting vaccinated out of Alabama's allotment?
Yeah, we heard the story that came up about that recently. I can tell you that in Alabama, actually 1.7% of our vaccine has gone to out-of-state residents so far. So not really very much. We're going to monitor that situation and see if that actually is an issue. I can tell you virtually no states are enacting residency requirements on who gets vaccine. There are a couple, I think, that have, but this is a national pandemic. It affects everyone. It's a free federal resource that the feds are making available to all states. So obviously at ADPH, we're prioritizing Alabamians. That's who our mission is to treat. But we haven't imposed a residency requirement on anyone. I would say if it becomes a problem and that's something we need to do, then obviously we'll consider that. So, yeah.
New reports, the Pfizer vaccine apparently highly effective with just one dose and can be stored in more so ordinary freezers. What are your thoughts on that? And then is this something that we could move towards and could help Alabamians?
Yeah, so there's some encouraging things there. So Pfizer is issuing some sort of new information about how it can be stored, and maybe the storage requirements aren't as stringent as we thought before. That would definitely make it a lot easier to get to certain areas that don't have that ultra cold storage capability. Also, it seems like Pfizer is just having a little bit easier time of ramping up its production maybe than Moderna. I think originally, because it seemed like Pfizer was such a finicky product that it was just going to be a bridge to get us to these other vaccines and then might not be used as much. But in fact, they're actually ramping up production pretty well. So I think Pfizer is going to be with us for a while. In terms of one dose, I would say I think all states are looking at that and trying to decide if that makes sense. No one has adopted that policy that I know of, but the science is encouraging on that. We just need a little more time for the experts to study that, and that may actually be a good strategy. It certainly would double the amount of people we could reach with our current Pfizer allotment.
Would that be a decision the public health department would make to decide one dose or not one dose, and who would you look to before making that decision?
Yeah, I think all public health departments would be making that decision in their own state, but typically we look to CDC experts in that field to guide us in making those decisions. Yeah.
With vaccines becoming more widely available, what is the guidance for, so to speak, a group of vaccinated people in the same vicinity, or are they still recommended to wear masks around each other?
Yeah, that's a really good question. So the answer is yes. They should do that. We want everyone, vaccinated or not, to continue to practice the good behavior that we've been preaching for so long. It's important to remember that no vaccination is 100% effective. Even these great vaccines that we have now are 93 or 94% effective, which is terrific and almost as good as any vaccine could be. And yet, some people still get infected anyway. Probably, even if you get infected after being vaccinated, you probably don't get as sick. Fortunately, you probably do pretty well. But that doesn't mean that you're unable to transmit it to somebody else. So the time to stop wearing masks and the time to stop worrying about gatherings is going to be when the case numbers go down and stay down and there's just not that much risk of catching it. Okay, so obviously the vaccine plays a role in that. The vaccine's a big part of that, and the vaccine is the way we're going to get back to normal at some point. But at this time, there's still disease circulating in the community. We still have cases, from basically every county every day, and so we want people to continue to be careful about that. So, yeah, let me go back here and then we'll.
Sporting events obviously have started back throughout the state. Wrestling is kind of finishing up right now. Baseball starting, track and field. Any guidance from you all with the High School Athletic Association? I know there has been, and with the state board, and what would you tell coaches, players, and parents?
Yeah, we've spent a lot of time talking with Coach Savarese and the AHSAA. They've been great partners for us, and they've done a really good job of trying to make sure that schools do things as safely as possible. We have very clear, straightforward guidance that we put out there. AHSAA has gotten that out to people. There are a lot of really good practices that are, at this point, kind of almost become common sense kind of practices. And we think that, in a lot of cases, these outdoor events particularly can be done safely, certainly for competitors. We certainly have concern about indoor sports, in a way that we don't necessarily have for outdoor sports. So we put out a lot of guidance on that. We'll continue to be available to try to help them with that as it comes up. But, yeah.
We just had a caller call in right now. They have a question. My husband is a cancer patient under 65, yet under CDC guidelines, still not eligible for the vaccine. When will people such as him be able to receive the vaccine?
Yeah, we want, everyone deserves to have the vaccine, and it's certainly not because we've said somebody's more important than somebody else or somebody's more deserving than somebody else. The problem is we just don't have enough to go around right now. So the persons that have chronic health conditions that predispose them to serious illness like cancer are in the 1C category of patients. So when we move to a phase 1C is when those patients will